This is Dr. Marty Harris, and today's topic is Multiple and Severe Disabilities, knowing these students. Each time we talk about a category with disability, we have to first examine the defining characteristics for that disability category, and then recognize the individuality within the group. Our agenda for knowing these students includes impact on family, learning and behavioral characteristics, assessment, and identification. When you think about the Forrest Gump movie, Forrest actually had multiple disabilities. He had orthopedic problems and he had cognitive issues. But Mama always had good advice for him. Stop this lecture and go take a peek at the Forrest Gump and Mama video clip. Impact on the family. We have discussed the cycle of grief frequently in this course. What we must stop and think about concerning multiple and severe disabilities and the impact on the family is the fact that daily living is significantly complicated by such disabilities. Therefore, the repetition of the cycle of grief throughout life stages may be even more significant. This model is called the circle of friends. The outer circle represents the friends that a person has among professionals. The circle closest to the person is the immediate family and relatives. The circle in between is the friendships that a person has from work, school, neighborhood, and activities. These are the ones we socialize with, call up on the phone, invite to birthday parties, have fun with, argue with, and do things with. A key factor for individuals with multiple and severe disabilities is their circle of friends. Research indicates that people with multiple and severe disabilities have a smaller circle of friends. When we make the effort to broaden that circle, these individuals are happier and more successful, and there is less burden on the family. When it comes to learning and behavioral characteristics, the first thing we have to remember is don't overgeneralize about these students. They are individuals. Although many of the students with multiple and severe disabilities have cognitive disabilities, many do have average intellectual abilities. Unfortunately, their intellectual abilities may be masked by their other severe disabilities. For multiple and severe disabilities, we must take a closer look at the input stage of intellectual functioning. The intake of data through the senses may be significantly altered and different. This then creates a cascading effect on the rest of intellectual functioning. On the other hand, it is possible that intake of data through senses is not altered as much as we, the observer, thinks. Consider the child who has cerebral palsy and cannot talk or indicate a response through movement. This child may take everything in that he or she hears and thoroughly understand and comprehend. However, this child may not be able to show us their understanding because their output is significantly blocked. An example of masked abilities can be found in the movie My Left Foot, the story of Christy Brown. This true story shows us that a person with severe disabilities may be taking everything in, even though they can only communicate with their left foot. Stop the lecture and take a couple minutes to watch a video clip from my left foot. Characteristics of students with multiple and severe disabilities. When thinking about these characteristics, the developmental domains are always a good place to start. For students with multiple and severe disabilities, we expand the developmental domains using this framework. 1. Intellectual functioning. 2. Communication skills. 3. Adaptive skills. 4. Motor development. 5. Health care needs. 6. Sensory impairments. Let's look at number 1, intellectual functioning. Most have significant intellectual impairments. Some have average intelligence, yet measurement of IQ may be difficult due to the complexities of the multiple severe disabilities. Number 2, communication skills. They may not talk or use gestures meaningfully, may not be able to follow even the simplest commands, may use alternative communication such as gestures, sounds and grunts, or eye gaze, may need to use augmentative communication, which will involve extensive training. Number 3, adaptive behaviors. Let's look at self-help and social interaction. Self-help usually require special training in basic life skills such as feeding, bowel and bladder control, dressing, and personal hygiene. Social interaction, limited by communication problems, may not play or interact with others, may appear to be out of touch with reality, may not show typical emotions, difficult to capture their attention or to evoke any observable response. Adaptive behaviors continued. Inappropriate behaviors and positive behaviors. Students with multiple and severe disabilities may have inappropriate behaviors such as ritualistic patterns, self-stimulatory, or self-injurious. Their positive behaviors can include a great sense of humor, sociability, persistence, and self-determination. Number 4, motor development and skills. Significant delayed development of both fine and gross motor skills. Significant limitations in both fine and gross motor skills. Most have limited physical mobility. Many cannot walk. Some cannot stand or sit up without support. Some have limited range of motion, hand grasp, or finger dexterity. Physical deformities are common and may worsen without consistent physical therapy or medical interventions. Number 5, healthcare needs. Frequently have multiple health complications, may be medically fragile, may need daily medications at school. Some medical treatments may be necessary at school that are actually related services. Frequent and often long absences from school require educational services at home or hospital. Number 6, sensory impairments. Vision impairments are common. Hearing impairments are common. Students with multiple and severe disabilities have a higher incidence of vision and hearing impairments than the general population. Common characteristics: they have difficulty learning self-care skills. They need repetition to acquire skills. They have difficulty with memory, problems transferring or generalizing learning from one situation to another, one setting to another, or one skill to another. Other common characteristics include the need for supports for many of life's major activities, such as domestic, leisure, community participation, and vocational. They need services from many different related service providers. Although identification of the student who has multiple and severe disabilities may happen early and quickly, assessment of needs and the abilities is often complex and needs to be ongoing. What should the assessment focus be? IQ may be assessed for school-age population. We should use adaptive behavioral scales and functional behavioral assessment, FBA. Dynamic assessments. That means when they are actually playing and involved in some activities, we are actually assessing them. Ecological assessments for infants, toddlers, and preschoolers. What is the natural environment for infants, toddlers, and preschoolers? The home. So that's where we should do their assessments. The assessment focus should include medical evaluations, communication evaluations, transdisciplinary evaluations. This means several different discipline experts observe a child at play and then collaborate on the results. Assessment of family functioning. How can we help the families? What do they need? For example, help with learning sign language, help with assistive technology, or transportation to therapy sessions. MAPS, Assessment Process and Planning. MAPS stands for Making Action Plans. It creates a profile of intensity of the needed support with a unique team meeting. As a team, they create a map of the student's abilities and areas of difficulty. They ask families and parents what is their greatest fear for this child and what are their greatest dreams for this child. Then they work towards achieving the dreams. Please read more about this wonderful process called MAPS online and in your textbook. There are two keys to seeing the potential of students with multiple and severe disabilities. One is working closely with families. Two is ongoing assessment to inform interventions and future plans. With these two keys, we can ensure that education is special for all students. Thanks for listening.